Good afternoon and welcome to the first Kaweah Delta virtual town hall meeting. My name is Gary Herbst and I'm the Chief Executive Officer here at Kaweah Delta. Back in May of 2016, when Kaweah Delta went to the voters and asked them to pass Measure H, we learned a really valuable lesson. Despite what we might have thought about ourselves in terms of how the community receives us and views us, where we thought we were very transparent and open and very engaging with the community, I think we learned that that wasn't the case. And so it was kind of a wake-up call for us. And we've spent the last 2 years really trying to change that. We've formed a number of different community advisory groups and ambassador groups to, again, further engage with them, have open discussion. We've learned a tremendous amount from it. And so we want to continue in that effort. So this virtual town hall meeting, which I hope will be the first of many, is to continue that dialogue with the community. And so I really want to thank you all for your questions. You didn't hold back, and I appreciate that. You learn a lot more from criticism than you do from compliment. So thank you for your comments and your concerns, your feedback, your questions. There are many questions that you pose to us, and in this short period of time, I wouldn't be able to address all of them. So we've kind of consolidated them into various themes. And the first one is the emergency department. The common theme is it seems to be way overcrowded. It seems to be very unorganized, that we don't always provide the consistent, compassionate, world-class care that we would like to. And there's no doubt about it. I couldn't agree with you more. It is very disorganized right now, and unfortunately that comes with major construction, major renovation. If any of you have ever remodeled your house, you've experienced that firsthand. And so this is kind of the investment we're making in the future to really create a different experience and environment for our community. So just recently we opened Zone 6 of the emergency department. That's a new 8-bed kind of, we call it fast track, but as you all know, that's kind of a relative term in emergency medicine. It is for lower acuity patients, scrapes, bruises, cuts, things of that nature, but it really has begun to take pressure off the main emergency department. Right now we're completing what we call Zone 4, which is on the north end of the emergency department, a space that we shelled in. That will be a 9-bed unit. Again, will open a little bit later this year and again give us greater capacity. The big project that's going on right now is the major expansion, what we call Zone 5, which is out in the east parking lot. It will literally, with the combination of Zone 4 and Zone 6, it will double the size of the emergency department. So unfortunately, the reality in Tulare County is many hospitals have closed. Kaweah Delta is the only trauma center between Fresno and Bakersfield. And as a result, all the ambulances come to Kaweah Delta from throughout the entire county. So we do draw a huge population, and it does make it very difficult for us in the emergency department. But that's why you've seen us develop more urgent care centers, more clinics. Actually, that's the reason that we're in Exeter and Woodlake and Dinuba and Lindsay, is to go into those communities rather than seeking care in our emergency department. So we'll continue to look for those opportunities. You may have heard just recently that we opened up we are opening a clinic in the city of Tulare on Prosperity and Mooney. And that's because tens of thousands of Tulare City residents come to our emergency department really seeking what I would call more primary care, that more appropriately should be seen in a physician office or in a clinic. So we're working really hard to alleviate the pressure on the emergency department, because we really want to be there to take care of truly emergent conditions. But facilities aren't the most important part. It's the quality of care that we provide and the compassion and the empathy. And I know that's not always our experience. I would say the vast majority of patients that come to our ED talk to me about the amazing care they got and the compassion they experience. But it's not 100% of the time. It's not consistent and constant. And that's really what we're working on. We really need to change. I think our new mission statement, our vision statement, is reflective of that expectation. Health is our passion, excellence is our focus, compassion is our promise to be your world-class healthcare choice for life. So those are very important words, very powerful. They mean a lot to us, and we are spending a great deal of time instilling that into our employees, our physicians, our nurses, so that is the experience that you have, world-class every single time. So thank you for those wonderful questions. Then there's a question on the overall quality of care at Kaweah Delta. And again, there are times where patients have poor experiences, and those are always disappointing to hear about, because I know that the people that work in this hospital, the physicians, the 5,000 employees, they come to work every day wanting to give their very best and to provide outstanding care to our employees. But that's kind of been what I call our Achilles heel. I think for the vast majority of patients, in fact, last year, 93% of all the patients that were admitted to the Kaweah Delta Medical Center rated their overall experience as an 8, 9, or a 10 on a 0 to 10 scale. Pretty good. Almost 80% of them gave us a 9 or a 10. But that meant that 20% didn't. And there's still 7% that rated as something less than an 8. And for those 7%, this might be their only experience they ever have with Kaweah Delta. So very disappointed that they came away not feeling that compassion and empathy. So we are really working on that. Again, I go back to our mission and our vision, the community advisory committees, the patient family advisory committees. We're learning from those mistakes. We do want to provide world-class every single time. And so my promise to you is give us an opportunity. Over this next year, you will see a different experience here at Kaweah Delta. Always a favorite topic, parking. Yeah, that's a huge challenge for us. It always has been. I've been here 28 years now, and I can't remember when parking was not at the top of everybody's complaint list. We are doing a lot here. In fact, right outside the Kaweah wing on the west side, you may see that we've actually created over 100 new parking spaces for visitors. We now have areas that are designated exclusively for visitors, and we monitor those lots throughout the day to make certain that our employees are not parking in them or other employers' employees, so making them definitely available for our patients and visitors. We also are exploring different opportunities to develop multi-story parking garages. So we have a beautiful garage right across the street from the hospital, the Kaweah wing, which is the Kaweah parking garage, and then we have the other over on Locust across the street from the Mineral King wing of the hospital. But as we continue to grow, and we are committed to staying downtown, we know that we need additional parking. So we're working with the city of Visalia right now. Mark Mertz, our Vice President of Strategic Planning and Business Development, is working with community leaders and other stakeholders in the community to explore building a parking garage right across where the old Checkers restaurant was. So where our multi-service center sits, right up against Main Street, that would be a beautiful location for a multi-story parking garage, still preserving retail on the ground floor facing Main Street, but providing significant additional parking for patients and family and visitors. We also are in the midst of a master facility planning initiative right now. We engaged a firm called RBB Architects about a year ago that is helping us look at the long-term development of our services, not just downtown, but actually across our entire organization, but definitely with a keen focus on downtown. And so a big part of that is also exploring parking options. So in addition to looking across Kaweah to the north there, we also are looking to develop something on the west property. So when we made a commitment a number of years ago, at really the urging of the community, but certainly the city council and downtown businesses, we made a conscious decision to stay downtown, which is, obviously it's more difficult to develop and grow in an area where you're kind of landlocked. So you've seen over the years that we've been acquiring property, moving west. Right now we pretty much own all the property right up to Willis Street. And so that you will see as Kaweah Delta grows, that will probably be the direction we grow. and that also could involve additional parking there on the west end of the hospital. So hopefully you'll begin to experience that in the near future. Okay, the fourth topic, billing. Always the worst part of a hospital stay. It comes at the end, and we know we can do everything beautifully from the time that a patient appears at the hospital and receives wonderful, compassionate, high quality, empathetic care. But if we also don't provide a bill in an understandable, accurate, friendly manner, it can actually ruin the entire stay. So we do work very hard to make certain that the billing process and working with the patient is also a good experience. But again, we know we fall down at times, that we're not always consistent. One of the things that's come up recently, and you may have read about this, as a hospital, when we create clinics or urgent care centers, they actually are licensed differently as from a private physician office or a freestanding private urgent care center. So our urgent care centers over like on Court Street or out on Demery, those are actually considered departments of the hospital, and they actually are on our license. And because of that, they are surveyed by the Joint Commission company that accredits hospitals, where you don't see that with freestanding urgent care centers or physician offices. They also must meet a higher standard of construction. They must be staffed differently. They tend to be more expensive. So one of the things that we struggled with for some period of time relates to a specific contract we have with Anthem Blue Cross. So Anthem Blue Cross, their HMO and their PPO plan, which many of our community members are enrolled in those plans, either through their employer or independent policies. Blue Cross uniquely has treated that urgent care center, both again on Court Street and Demery, as if it was almost an extension of our emergency department. And so I met just probably 2 weeks ago with our revenue cycle leaders to say, how can we change this contract? Because again, it is unique. Blue Shield, Aetna, Cigna, our contracts with them treat our urgent care centers just like any other urgent care center in town. Just your typical copay, no co-insurance. But Blue Cross has been different. And so I have instructed our team to modify, to renegotiate that agreement with Blue Cross. It's going to be difficult for Blue Cross to manage in their system, but we're going to make it happen. So that change will be taking effect shortly. So when you come, if you are an Anthem Blue Cross member and you come to one of our urgent care centers, your experience would be exactly the same as if you'd gone to a freestanding urgent care center. So that should be happening very shortly. With respect to physician recruitment, we have 2 full-time dedicated physician recruiters, Brittany and Sarah. We also have 6 different graduate medical education residency programs with about 130 residents, so doctors that have graduated from medical school but are going through their final training. About a third of those physicians that have graduated from their residency program have chosen to stay in this community and work. And so that was absolutely our desire, our dream, and it's coming true, and very excited to see that. And then most recently, we've actually brought 19 new physicians to our community since July. So Brittany and Sarah, working with other community physicians, have been very successful, but we still have a long way to go. Our goal for this year is to bring 51 additional physicians to our community. So a pretty tall order, but I think everybody working together, Visalia is an incredible place to live and work, and so we are very excited about that opportunity. You also see that we're developing, again, rural health clinics, urgent care centers, trying to create places for our physicians to work. One of the questions that came up is, will Visalia Medical Clinic, who is now a partner of the Kaweah Delta Healthcare District through our Kaweah Delta Medical Foundation, will they ever see Medi-Cal patients? Well, the reality is they actually do see Medi-Cal patients now. Many of their physicians work in our rural health clinics, they work in our chronic disease management center, the Kaweah Cardiology Clinic, and they will be staffing the Tulare Clinic, the Kaweah Delta Tulare Clinic, when it opens next year. Those are Visalia Medical Clinic physicians, primarily specialists, working in those clinics and seeing Medi-Cal patients. So that is already happening, and just our relationship with Visalia Medical Clinic and the Medical Foundation has been one of our most important vehicles to bringing new physicians to this community. And then lastly, recruiting and retaining the best employees. And one person asks, why are our staff not unionized? And I think the short answer is because they don't want to be. Employees generally form unions or join unions when they don't feel supported or respected or appreciated, and most importantly, when they don't feel listened to. I don't think that's the case here at Kaweah Delta. We have been non-union for our entire existence. We are very committed to creating an ideal work environment for both our employees and for all of our providers, our physicians and advanced practice providers. Every 2 years, we actually conduct a formal survey, an employee engagement survey, to hear the things that we're doing well and the things that we're not doing so well. And so that survey was just conducted back in May. We're meeting with all the employees to better understand some of the comments and the opportunities for improvement and developing specific action plans around those. And we expect to be completed with that process by December and then begin implementing those plans in the coming months. We do continue to recruit employees. It's a challenging market right now, no doubt about it. Healthcare provides more opportunities for employment than just about any industry across the country. And so, and at a time when both our country and our state are experiencing some of the lowest unemployment that they've had in decades. And so the resource market out there is a little slim right now, but we are aggressively marketing and recruiting employees, particularly nurses, RNs, LVNs, certified nursing assistants. Just since March, I think it is, we've added 130 additional nurses to our workforce, so very excited about that. We've implemented significant increases in compensation across many of our clinical categories, particularly in nursing, offering sign-on bonuses, retention bonuses. We have some of the most generous benefits in health, dental, and vision. So we're doing everything possible to attract and retain the best and the brightest employees. I would personally like to thank everyone for joining us today. Again, I appreciate your comments and your feedback and your questions. I assure you that I take them very seriously, and I will engage with my leadership team to work on the many things we talked about today, the many opportunities that you've shared with us. I look forward to more of these virtual town hall meetings, as well as actually doing real life town hall meetings, which we hope to be launching in the coming months. So I invite you to attend those. Hopefully you'll find them informative and give you that opportunity to help Kaweah Delta become a better organization, a better hospital for you. Thank you.